From KPRC 2, this is Houston Newsmakers with Cambrell Marshall.
So, question for you this morning: how's your health? And what does that even mean anymore? The term health encompasses so much more these days than what the doctor tells you at the office or the emergency room. And more Texans are starting to say they need help for coverage of non-medical health care issues. That is a revelation from a survey to be released later this week by the Episcopal Health Foundation. I'll get to that important survey in a moment. But first, I want to say good morning to Dr. Ann Barnes, who as of this month became the new president and CEO of the Episcopal Health Foundation. Good morning. Good to see you again.
Good morning. It's good to be here and good to see you too.
I've seen you through the years, and when I heard that you were first elected for this, it seemed to me a perfect marriage. He's a Harvard-trained medical doctor, a master's in public health, and you've been on so many levels. You've been the Legacy Health, seeing that part of the community, Harris Health, seeing that part of the community. This seemed like a marriage just perfect for you.
Yeah, no, I'm really excited to be a part of the foundation. When I was practicing as a primary care doctor, I saw a lot of patients who came in with the same conditions and really listened to their stories and realized that so much of their health outcomes were a result of what was happening in their life circumstances outside of the clinical setting. And so that started my career in this space, looking at non-medical drivers of health. And then when the opportunity came to consider this position, I really saw it as an extension of what my life work has been, with an opportunity to impact even more Texans to improve their health. And so it really is a job of a lifetime. And
now, within your first month, the foundation will report that more than 2/3 of Texans are advocating for more help with non-medical factors. Who made up this survey, and what term is meant by non-medical factors?
So our team, in partnership with another entity, created the survey and administered it to Texans to really begin to understand, do people recognize that health is more than just what happens in the healthcare setting? And this confirms that Texans not only recognize that non-medical drivers of health are important, but see a role for the state to support and fund efforts to address those non-medical needs.
I'm sure you will correct me if I'm wrong, but isn't this a reflection of what has been an increased emphasis on behalf of healthcare professionals who see these patients on a regular basis? Maybe their patients and people around them are starting to recognize that this lifestyle that we have now needs more help, that not necessarily what has been traditionally provided by doctors.
Yes, I think you're absolutely right. I think that as providers, the idea of writing a prescription or patching someone up and sending them back out where the same things continue to happen is not at all satisfying. And if our goal is really health, we have to think about all of the factors that play into health. For example, if you have a child with asthma, they come into the emergency room, you give them medications, but then they go back into situations that flare up their asthma. Doesn't it make more sense to actually do things to mitigate the triggers for asthma so that they are not sick and they don't have to come in for costly sick care in an emergency room or hospital, but actually live a much healthier life? And
of course, that's going to cost money, and that means the state, somebody's going to have to provide that money, and that's what the survey did. Let's talk about a little bit about the survey, about support, and obviously it's talking about support for state spending for non-medical. This kind of mirrors our society in a couple of ways. First, I'm not too shocked that Hispanic and Black participants in the survey registered quite a bit higher than whites in wanting to spend more on those non-medical issues. And then again, more Democrats and Republicans wanted more. I looked at this, and so that's a difference that I'm not really shocked at either, because of the political environment we're in. Some want to spend more, some want to spend less. And also, 18 to 29-year-olds, much more likely than those above 50. What do you make about some of these results from this survey?
Yeah, no, it's always interesting to see how different groups break out. I think it's interesting that the majority of Texans who were surveyed feel like this is an important issue and the state should support it. I think that you find that in communities of color, that chronic diseases are highly prevalent in those communities. They also struggle with socioeconomic challenges, transportation challenges, access to healthy foods. So I think it's top of mind for our communities of color. So again, that doesn't surprise me as well. In terms of the age groups, I agree. It's really interesting that younger individuals seemed very interested in how we address social determinants of health or non-medical drivers of health. And, you know, we don't know for sure why it resonated with that particular group, but I think that younger individuals are more mindful about how their life circumstances influence their health and feel that that's important to address.
Because of all the different communities you've experienced from the standpoint of a medical doctor, now with the Health Foundation, do you take the role of advocate on this? Do you provide the survey and then do you fight to get the money, or how does that work?
So, you know, we really rely on evidence to frame how we present information to decision makers and leaders. We just want them to know what's out there, what the constituents feel, the truth about how non-medical factors influence health, to help them make good decisions, because I think at the end of the day, we all want Texans to be healthy. We want every community to be healthy, and so this is our way of giving them the tools that they need to make sound decisions for our communities.
Absolutely. So the elected officials, everybody along the way who has any touch point with healthcare or money for it, those are the ones. So those people and more, I'm gonna walk for this. So as soon as I see this coming out, I'm gonna go through it and look through it. Who else do you think is the most important constituents who should be reading this survey when it comes out next week?
So health systems as well, because they interact with patients, especially our healthcare systems that treat the uninsured. It's really a priority for them to keep individuals healthy, because it's very costly to just take care of the sick. So I think health systems are an important constituents. And then just the larger community, because I think as Episcopal Health Foundation has really transformed the conversation about that it's about health, not just health care. I think that we need more community members to indicate to decision makers who influence their lives, whether it is the state or local government or health systems, that they begin to advocate for what they need.
Well, I'm looking forward to reading it. I'm going to put the information about the foundation and that report on my Newsmakers page on click2houston.com. Thank you, Dr. Barnes. Good to see you, by the way. Full disclosure, we've worked on different organizations together, and I've always been looking up and saying, I want to be like him. Hasn't happened yet, but congratulations on this new venture in your life.
Thank you so much.
Appreciate you being here.